Hi, my name is Carter, and I'm a second-year medical student at the University of Pennsylvania. And John Shin is a dental student at the University of Pennsylvania. And we both worked for Public Citizens for Children and Youth over the summer. And we'd like to thank our academic preceptors and community preceptors that are linked on the slide. And we are going to give you a little presentation on what we did over the summer with PCCY. So our community partner is Public Citizens for Children and Youth, or PCCY, and they are a child's policy/advocacy organization that offers both direct service work as well as broader advocacy initiative type work. Their focus areas are healthcare, pre-K through 12 childhood education, nutrition, as well as child care, and they do a lot of work with other partner organizations to pressure legislators into signing certain bills on behalf of children.
Our contribution at PCCY involved 3 projects. I mainly worked on school nurses and counselors manual, as well as social media outreach. Carter mainly worked on Lead-Free Philly Coalition project. With the first project, the School Nurses and Counselors Manual, as an intern, I assessed and identified healthcare providers in order to update the manual, containing an updated list of healthcare providers that provide free or discounted services to uninsured children. This manual empowers both school nurses and counselors to efficiently guide both parents and children to healthcare providers that will be able to provide service. Secondly, I contributed in the social media outreach to immigrant children to share information and create awareness about PCCY's free helpline that helps all parents and children enroll in public health insurance programs called Medicaid and CHIP. Finally, Carter worked in PCCY's statewide lead initiative, which involved reaching out to numerous organizations to gather data and expand a lead coalition dedicated to removing lead from homes in order to reduce the number of lead poisoning in children. This slide highlights what we were able to accomplish and contribute to PCCY's important works. In an effort to update the School Nurses and Counselors Manual, I assessed over 50 providers in Bucks County and 150 providers in Philadelphia County. My work focused in identifying providers in behavioral health, drug and alcohol treatment, grief counseling, family planning, and LGBTQ. It also involved updating organizations or each provider's contact information and verifying Medicaid and CHIP acceptance. In social media outreach, I shared information about PCCY's helpline via 18 social media posts, as well as reaching out to over 135 cultural organizations through Facebook and Twitter.
So as John mentioned before, I was doing some work with the Lead-Free Philly Coalition within PCCY, and pretty much I gathered a list of lead remediation companies that are certified in Pennsylvania. I plotted them on this map that you see in the bottom right, and then I conducted a phone survey to pretty much assess the state's capacity to do remediation work, ultimately to show that data to legislators to advocate for more funding. I also worked with some community development corporations and registered community organizations to see if they'd be interested in an information session that we will be hosting with the city on the new lead law that is going into effect October 1st. This summer with PCCY and Bridging the Gaps, I really think it did impact my professional career development. I've always been interested in career and policy, but working with PCCY and seeing it play out in real time definitely solidified my desires. It was so fascinating to watch them advocate for children within the complex American political system. And lastly, I really love the Wednesday sessions with Bridging the Gaps. The last couple months have been incredibly challenging in so many ways, and they brought in very relevant and remarkable and inspiring speakers to create important dialogues that I think the entire country needs to be having. So I really appreciated that aspect of the program as well.